Doctors of Reddit, what is a 1 in a million chance thing about your patient you have witnessed? One of my patients nearly died from an amniotic embolism while she was in labor. It's so rare that the only way to diagnose it is by ruling pretty much everything else out first. It's essentially when the amniotic fluid accidentally passes into the mom's bloodstream. She had a cardiac arrest and we did CPR while doing an emergency C-section. She is slowly recovering but has lost most of her brain function. Inserted a urinary catheter to a female patient. She complains of pain where the bladder is situated, and it was distended. No drainage per catheter. When we pulled the catheter out, there it was, a worm which got stuck inside the tube. How the hell did the worm enter the bladder? I was a paramedic and I came to a scene where I had a patient who was talking to me, but he had no blood pressure, and no detectable pulse. I couldn't even hear his heartbeat with a high-quality stethoscope. They dumped a few bags of fluid in him in the ED before they were barely able to get a BP on him. Story from last year, after a pretty uneventful pregnancy a woman goes into labor but it doesn't advance as quickly as it should so she gets a secondary cesarean section, standard procedure. The baby gets out and its eyeball is almost pressed out of the eye socket. Everybody is in shock, the parents start crying, we don't know what to do. Turns out the child had a huge tumor of the temporal lobe which pushed the eye out. We later analyzed the ultrasound pics and the tumor was already there so it just got overlooked. Brain tumors in neonates are even rarer than 1 in a million, it's actually 0.3 per million so I hope I'll never see such a case again. Edit. Unfortunately I don't know the outcome, the child was transferred to another hospital. I once saw an 4 drug user who managed to break an old needle off in his vein when injecting and presented with chest pain. It was only when we were doing an angiogram we noticed the needle fragment embedded in his heart. I've never seen this before or since. TLDR, needle inside the heart and a drug user, couldn't get it out. Bad situation. My dad somehow got a blood infection that, normally, only dogs can get. My mother, now retired, was a GP in the middle of nowhere, in southwest France. In the early 90s, she had her first HIV cases. With the med at the time, they did not last long. Except one. Clearly HIV, but not developing AIDS at all. He was one of the few people with natural immunity. Had a patient come in with headaches and she was a young woman. Her entire body would go numb with these headaches. Got a CT. She has 3 separate tumors in her brain. My aunt and uncle-in-law are both doctors. Once, she was lying on his stomach and she heard something odd in his pulse, blood flow. Went to the hospital that night and he had surgery to resolve an blockage which if it had ruptured he would have been dead in 10 minutes. All by pure chance. Was operating on a pregnant lady that came in having been shot in the belly. OB delivered the kid through our incision and the baby had a perfect line across his shoulder where the bullet had grazed him. He was totally fine and didn't need stitches. Mom lived too. Seen a patient whose triglycerides were so high that it gave him pancreatitis. They talk about it in the textbooks but it is extremely rare. It was due to a combination of causes, including drugs he was taking for HIV. Now the crazy thing was when we drew blood it actually separated and there was a supernatant of fat that you could see in the vial. Not a doctor but, I have a pretty rare condition called C-choose inversus. Which is a condition where all my internal organs are mirrored so my heart is on the right side and so on. All the doctors are always amazed by my condition since they've never seen anyone with it. So I guess I'm some of those doctors' 1 in a million patients. I have a patient with stiff person syndrome. The prevalence of this is literally 1 to 1 million. A guy with chronic kidney disease came to the ER on a delirium state, his consciousness rapidly declined and he went into cardiac arrest. Spent 7 minutes doing CPR while we corrected his potassium levels, the cause of the arrest. He recovered with no long-term brain damage, which is very damn likely to happen when you spend that much time brain dead. Some weeks ago we played a match of table tennis and he was okay. Good stuff. I had a woman come in for her 11th delivery when I was an intern in a government hospital in India. She hadn't had a normal menstrual cycle since the birth of her first child. Kept alternating between pregnancy and lactational amenorrhea. The patient got to choose a name for her disease. Not me but my wife. She had a patient with a colostomy bag. The colostomy hole had an STI in it. I'll let your imagination figure out how she contracted the STI. Paramedic here. A coworker of mine was out biking with some friends when one of their riders collapsed and went into cardiac arrest. The group lined up and provided CPR for this 50-year-old guy out in the forest until EMS finally arrived and extricated him. They did CPR on him for an hour and he survived with no deficits. Pretty slim chance of survival, but shows what good CPR can do. One of my clients is a surgeon, said the craziest thing he's seen was that his patient's heart was backward. There was no record of this and he was shocked that nobody caught it. Copremesis on the table. The patient was literally from their mouth because of an obstructing colon cancer.